in my opinion, when you put together, things like diagnostics and precision medicine, you put together supplementation and preventative medicine, and you put together telemedicine, which we know removes geographical constraints, then what you have is an opportunity to take a 6-figure business to 7, a 7 to 8, and an 8 to, in my opinion, even a 9-figure business. Hey guys, real quick, I got a quick training for you. Today I'm going to talk with you about some of the things that we're seeing in the marketplace and some things to be conscious of if you're in the healthcare industry and you're looking to grow your organization. And this comes from, kind of some experience that we're seeing with our clients. Over the last year, we've had an opportunity to work with diagnostics, with doctors, both in preventive medicine and then also pain management. And we've also had an opportunity to work with the emerging market in at-home diagnostics. So we have laboratories that are customer of ours. We have companies that we build out product offerings that are direct-to-consumer diagnostics. So that's B2B, and then also B2C diagnostics. And in addition to that, we are in process of building out telemedicine applications, also precision medicine utilizing diagnostic services, and preventative medicine utilizing supplementation and helping some of our clients build out online stores. Now, this actually comes from a relationship that we've created with a wholesale supplement manufacturer who is specializing in building out white label supplements and taking doctors' formulations and bringing them to the market in a cost-effective way. So there's a lot of really great stuff going on. I just kind of want to share where we're at and some of the things that are super exciting because, in my opinion, when you put together, things like diagnostics and precision medicine, you put together supplementation and preventative medicine, and you put together telemedicine, which we know removes geographical constraints, then what you have is an opportunity to take a 6-figure business to 7, a 7 to 8, and an 8 to, in my opinion, even a 9-figure business. So I'm going to talk with you about some of the things that we're working on and some of the exciting projects that we've had an opportunity and are truly blessed to work on, and kind of my perspective in regards to where the market's going from a healthcare standpoint. Now, when we take a look at healthcare and some of the things like COVID have taught us, and I don't even know if I can say that without getting blacklisted on YouTube, but COVID and, some of the kind of the directions. And I was actually in financial services about 20 years ago. In 2002, 2003, I was in financial services, and one of the things that we sold was health insurance and life insurance. And we sold life insurance as whole life and equity index life as a retirement vehicle. But in addition to that, of course, life insurance is incredibly important in order to A, transfer wealth, and then B, also to make sure that you have a benefit left over to your loved ones, that your loved ones are taken care of. So during that process, I kind of saw how insurance worked and inevitably what it incentivized in regards to insuring people, because we had to go through the process of getting people cleared for life insurance, getting people cleared for health insurance, and really structuring their entire financial package in order to accommodate, both insurance needs and then also costs, budgeting, retirement, mortgage, and everything like that. So that's kind of where I got my start. And then I moved into sales, marketing, and marketing technologies. And inevitably, I ended up opening up Razor Sharp Networks over a decade ago. And we've been helping our clients optimize their online environment and automate their customer lifecycle. Now, over the past year to year and a half, I've had a great opportunity to work in the healthcare industry and really kind of leverage the knowledge that I learned, 20, 30 years ago. Not 30 years ago. I'm not that old. 20 some odd years ago, about the insurance industry and what they incentivize. Because if you take a look at healthcare and the way that healthcare works, Medicare and some of the other healthcare providers out there, Blue Cross, Blue Shield, and some of the major healthcare practitioners out there, what you'll find is the way that they incentivize doctors is to really take a limited amount of time associated with their healthcare. Now they're starting to, work more towards or lean more towards preventative medicine, because it just makes sense in order to fund preventative medicine because it saves you money in the long run. But the reality of it is that they're not there yet. So you have doctors that are specializing, that are integrative healthcare practitioners that spend more time with their patients and really focus on a holistic approach to their patients' healthcare needs. I'm kind of ranting right now, but hopefully we'll be able to pull this all together in the end. So what we're finding, or what I'm seeing in the marketplace, is a huge call for supplementation and preventive medicine, a huge call for diagnostics and precision medicine, and a huge call for telemedicine and really getting access to specialized, personalized healthcare that gives us the ability to spend a little bit more time because we remove the geographic constraints associated with healthcare. In the past, healthcare was restricted by geography, meaning that no matter where you were at, you had a limited selection associated with primary care, pain management, precision care, specialists, and things of that nature. Unless you were incredibly wealthy and could travel throughout the United States or whatever country that you live in, you had limited access to these specialists. You had limited access to the healthcare providers that were in your geographic area. Well, that is being removed. What COVID has taught us is that buying behavior has fundamentally changed forever. More people are comfortable with buying online. More people are comfortable with Zoom meetings. More people are comfortable with teleconferencing and things of this nature. And more people are becoming more and more comfortable with telehealth services. And when you think about that from a business standpoint, and if you're a practitioner that's looking to take your business to the next level, one of the things that you should be focused on is building out your telehealth solution and really creating an environment where you're not geographically restricted, because that's one of the things that COVID really forced upon the population, is the fact that we were forced to telecommute, we were forced to teletreat patients and forced to utilize telehealth more. And these things became more and more common and or accepted, right? So what COVID did, in addition to shutting down the United States, is it gave us a comfort level with buying online and also doing things like telehealth. And what it did is it pushed customers, and it made them try and or seek more remote services, because they realized that if they moved outside their geography and sought more remote services, they could get actually better services from people who have that figured out. So that's the first thing that it taught us. The second thing it taught us is that healthcare is a commodity, right? Healthcare is a commodity in regards to what it is that is delivered. So if you want to take your healthcare practice to the next level, the thing that you need to do is decommoditize what it is that you offer. And the way that the insurance companies incentivize most healthcare practitioners is they de-incentivize the most highly valued activities. The most highly valued activity for a doctor is time, right? And being able to spend one-on-one time with patient care and being able to hold your patients to a high level of accountability if you're presenting them with a health plan or you're presenting them with a treatment plan and making sure that they're following that treatment plan is the highest value activity, but it's actually de-incentivized by the insurance companies, right? They de-incentivize those long patient visits. They de-incentivize preventative medicine and or follow-ups associated with things that you've not been diagnosed with yet. It's interesting because, when you go to the doctor and you think you have an ailment or something like that, or you're not feeling well and you haven't been diagnosed with something, it's almost a challenge to get any type of diagnostics done. You almost have to come out of pocket and go direct to consumer with the diagnostic service, meaning that your primary care practitioner, if you're utilizing a major insurance brand, is not going to order, per se, like hormone testing or vitamin testing or deficiencies, unless you have something that's really severely going wrong with you. Meaning that if you go in just feeling slightly off, and let's say that, you want to get tested for a hormone imbalance, they're not going to do that for you unless you have some type of acute symptom associated with that. It's symptom-based treatments, meaning that you have to wait until you're having some type of negative symptom in order to get treated and or do any type of diagnostics or preventative medicine, which in my mind is completely backwards. I think that, when you're feeling off, when you're not performing at your best, when you aren't living your best life or achieving your best results, no matter what age you are, you should be able to go to your primary healthcare practitioner and get the diagnostics that you need from a hormone standpoint, from a vitamin standpoint, from a treatment standpoint, whether it's cancer treatment and diagnostics, whether it's blood sugar treatment and diagnostics, whether it's vitamin deficiencies, treatments and diagnostics, whether or not it's hormone imbalance treatment and diagnostics. There should be a path for us to easily access these technologies that are out there. And so that's what we're going to be doing. We're going to be bringing these types of technologies to healthcare practitioners so that they can, A, provide a better product to their patients, and B, scale their businesses in ways that maybe they haven't thought about in the past. Take their 6-figure business and scale it to 7, and take their 7 to 8 and 8 to 9, utilizing preventative medicine and supplementation, utilizing diagnostics services and testing, and utilizing personalized care in a way that gives us the ability to spend more time with our patients and deliver a better product or service. So that's our goal and our vision. And really, we've come to this space because the reality of it is that, we've had a great opportunity to work with B2B diagnostics facilities. We've had an opportunity to work with B2C diagnostics facilities, supplement manufacturers and white labeling companies that we can give people access to. And then we've also given ourselves the opportunity to work with healthcare practitioners who are looking to scale their businesses and figure out how to, add additional streams of revenue. It's way easier in order to offer 6 products to one customer than it is to offer one product to 6 customers. So think about that, and hopefully you think about what it is we shared with you today. There's going to be a lot more information that's to follow. We're super excited about some of the things that are coming out in 2023, and hopefully we'll get an opportunity to talk with you. If you have any questions, go ahead and leave those in the comments section if you're on our YouTube channel. If you're not, jump over there, subscribe to the channel, set up notifications so you can stay up to date on our future projects and also trainings associated with innovations in the healthcare industry and also innovations in precision medicine, diagnostics, preventative medicine, and telemedicine. Looking forward to speaking with you. Until the next time, make today and every day a fantastic day. We'll talk with you real soon.